Following the IATF's approval of increased annual deployment of healthcare workers, the Philippine Overseas Employment Administration, or POEA, announced that medical workers with complete requirements can now get their exit clearance document for them to work abroad. Kenneth Paciente has more.
1,500 healthcare workers have been allowed by the government to work abroad. This is an increase to the 5,000 deployment cap, which was already reached this June. Philippine Overseas Employment Administration Administrator Bernard Olalla said this development was a result of talks between Labor Secretary Silvestre Bello III and the IATF. Because of this, nurses and other HCWs who completed their documents and requirements, especially those who've secured contracts and working visas, should now be given Overseas Employment Certificate or OEC.
Exempted naman po sa CAP yung mga government-to-government deployment natin at saka yung balik magkagawa natin. Ang tanging mabibilang po sa CAP yung mga natitirang agency hires at saka yung direct hires po.
Dennis, who was about to fly to Jeddah, Saudi Arabia to work as a nurse but postponed because of the deployment cap, was delighted by this. He said that his agency is processing his OEC.
Makakatulong kami sa pamilya namin ng gastos, lalo na ngayong panahon ng pandemya. Malaking tulong to para sa amin kung makakaalis talaga kami.
But the POEA asserted the number of Pinoy's HCWs allowed to go abroad must be balanced, especially since their role in fighting the pandemic here at home is essential. But the agency maintained they respect those who seek better opportunities abroad.
Ang number po ng nasa hospital and private facilities natin nasa 183,000 nurses. So may kulang po tayo or gap na tinatawag na 120,000 nurses. Kaya kinakailangan po nating tignan, balansehin yung pangangailangan natin sa sarili nating bansa.
The Philippine Nurses Association said this is a welcome development that will help many healthcare workers. They also acknowledged the needs of medical workers here in the country but then pleaded.
Titingnan din natin yung welfare ng ating mga nurses at yung opportunity na naghihintay sa kanila na pwede nilang makuha sa ibang bansa na hindi natin na ibibigay dito. We recommend na tanggalin na lang natin yung cap, no? At or dagdagan natin yung cap na hindi naman masasakripisyo yung sarili nating healthcare system.
Meanwhile, the POEA is hoping that through the nursing licensure examination of the Professional Regulation Commission next month, the number of nurses and HCWs will increase. Kenneth Paciente for The Nation.